Hello and welcome to the first of 3 videos prepared on behalf of the North Queensland Primary Health Network to work with local governments and other interested agencies across the North to identify just what role each organisation can play to help contribute towards chronic disease prevention in Northern Queensland. This video is the first of 3 videos that you can access to help you work through a self-paced series of information to help identify what kind of role that your organisation might be able to play to all continually work together and maybe take a piece of the puzzle towards contributing towards chronic disease prevention across Northern Queensland. In this presentation, we set the scene for what chronic diseases are in the North, how this affects our populations, and start to unpack what we can all do as different organisations to play a role in preventing chronic disease and building healthy communities. So we're going to talk a little bit about the North Queensland population health, a little bit about the needs assessments that have been done by Northern Queensland Primary Health Network and other agencies to identify just what those population needs are in terms of chronic disease prevention. Importantly, we're going to talk about the impact of a healthy community, particularly those additional benefits like economic, social, crime and safety and environmental kind of benefits that happen as part of building a healthy community. And then we're just going to make reference to the strategic directions of the PHN and some of those goals that everyone can work together to help build healthy communities across Northern Queensland. There's a current health needs assessment undertaken for Northern Queensland communities, which is relevant up to 2022. And it looks at socioeconomic factors. The key issues include a high proportion of socioeconomic disadvantage in Northern Queensland regions, some poor quality employment and higher unemployment rates. There's also issues around some early childhood care and provision of education. Importantly, we know that more people in the 2 most disadvantaged quintiles than the rest of Queensland. We also know that around 65% of Northern Queensland local government areas have slightly higher unemployment rates compared to the state average. And we also know that there are education differences across our state. And all of these are important to consider when we're looking at what role different organisations can play in building healthy communities. When we talk about chronic disease prevention, we're specifically talking about those chronic diseases that have risk factors that contribute towards them that could be prevented with some lifestyle changes. We certainly refer to issues that relate to individual change, but importantly, when we're thinking about the role that organisations can play, we talk about the role of place and the role of community and also the role of policy in what can be done within the environment of the community to help change those behavioural risk factors and enable communities to lead healthy, thriving lives, build healthy, thriving economies, and ultimately build healthy, thriving North Queensland communities. One of the behavioural risk factors that we look at is around overweight and obesity. And we know that there is right across Queensland, in fact Australia, and many different countries, high overall proportion of overweight and obese adults. In fact, Queensland Health tells us that the Northern Queensland region has the 3rd highest rate of overweight and obesity in Queensland. And it's an issue that we all need to be concerned about and take some action for. We also know that there's behavioural risk factors such as tobacco smoking. There are higher daily rates of smoking in the North compared to some other areas in Queensland. And daily smokers tend to be around, the 2nd highest risk factor contributing to that total burden of disease in remote areas. So tobacco smoking is something that together we can also look at to help identify just how we can all contribute towards reducing that tobacco consumption and increase healthy communities and that contribution towards healthy people, healthy place and healthy policy. One of the other behavioural risk factors that we can look at in terms of chronic disease prevention is alcohol consumption. We know that there's a higher risky lifetime alcohol consumption across much of Queensland, and that risky lifetime drinking rate is higher than the state average amongst persons aged 18 plus. The population health status profile for North Queensland shows us that around 20% of the population are children and around 14% are aged 65 plus. We also know that around 7% of those hospitalisations are potentially preventable. Importantly, when we look at infant and child risk factors, we also know that there's some smoking incidents in women who are pregnant, but also we know that there are stats that relate to things like childhood sunburn. And with that being in the previous 12 months, this was 2018 to 2019, around 53% of children being sunburnt. So it's important when we think about what are those risk factors for chronic diseases that we're able to package those together and address them in a holistic way. We certainly know that identifying specific risk factors and addressing them one at a time can sometimes contribute to health fatigue or health behaviour change fatigue. And this happens continually when communities are overwhelmed sometimes with information about things they need to do to change their health and lots of individual actions rather than packaging them together in easy to follow lifestyle information, as well as creating environments in the community that can really make a difference in enabling those communities to make those healthy lifestyle changes and fulfill those ambitions of becoming healthy communities. So particularly when we're talking about chronic disease prevention, we're focusing on a number of those adaptable behavioural risks. So overweight and obesity, like we talked about, tobacco smoking, alcohol consumption, sun safety and sun protection are really important ones for us in Queensland, and also issues that are surrounding mental health. We know that packaged together, a number of these strategies underpinned by healthy eating are a really important combination of risk factors that can help us reduce our daily burden of disease and that overall contribution to building healthy communities. We also know that more broadly on communities, there are many benefits of working towards becoming a healthy community. These can relate to economic benefits, social benefits, crime and safety, environment, and even recognition for individual councils. Now, we know that the audience for these videos is likely to be a range of organisations. And of course, the plan for us was to be able to run these as workshops right across North Queensland. But we know that the restrictions across 2020 and that have continued into 2021 have made that really difficult. So we're referring to council here, but relating to council as the hub and the heartbeat of community. So that also relates to other organisations which you may be well representative of and playing a really important part of building your community and identifying some of the ways that your organisation can contribute along with others towards building those healthy communities across the north. So these benefits, if we're talking about economic benefits, they include things like benefits to tourism through infrastructure walking trails, and also really importantly, those benefits towards accessing local shops and local services and local facilities by well-designed local neighbourhoods. So being able to contribute economically is really important. We know there's also other simple benefits, such as benefits to the local economy through buying local produce and having healthy, fresh, affordable fruit and vegetables available for purchase through communities. We know that some of those social determinants, including increased livability, there's sustainable communities through the reduction of a carbon footprint, and this can include improving walkability, improving physical activity and incidental physical activity as a way of commuting around the community. We know that a lot of areas in North Queensland that walkability is really difficult simply because of the tyranny of distance. So there's also other ways to think about how we can contribute to that social connection and that social connectivity, which is so importantly part of building healthy communities. We know there's also a legacy of improved community health through social inclusion of quality of life. Crime and safety can often have benefits from building healthy communities as well. There can be an improved perception of community safety through an increased presence of people in public spaces, for example. We also know that by providing facilities and services and programs for people to remain engaged in both social and employed activities can also contribute to reducing crime issues and improving safety. There can be environmental benefits as well, such as improved open spaces and physical infrastructure, protection of biodiversity through the provision of parks and natural environments. Increasing green space is an incredible benefit to both building healthy communities and also contributing to healthy place through our local environments. We also know that there's improved air quality from reduced vehicle congestion due to higher levels of cycling and walking, and maybe also use of local public transport, or maybe reducing the need for additional trips and journeys where possible. And sometimes that's only going to be possible in some of the larger regional centres. We know that councils becoming involved in building healthy communities can also be beneficial organisationally. There can be recognition as a progressive organisation, some positive public relations opportunities. There can be also opportunities around enhancing council's role as a proactive leader. And it can also strengthen those intergovernmental and community partnerships. It provides sometimes that heartbeat and that hub for organisations, potentially like the one that you are representing, to come together and work collectively towards those community goals. What that can be underpinned by is a really great plan and activity, which we'll explore in some of the subsequent videos, about how to develop those consensus plans and everyone to have some short, medium and long-term goals to work together so that each organisation can then integrate that into their usual way of working and into their strategic plans as well. So in the North, there is a strategic plan from the Primary Health Network that also supports this vision of Queenslanders living happier, healthier and longer lives. We know that the purpose of the PHN is to drive change within and support primary healthcare to improve individual and community wellbeing. So there's already a fantastic foundation across the North to benefit the action, the activation and the elevation of healthy communities right across the regions. And this includes placing individuals at the centre of their own health, working with communities to understand local needs and to design and implement solutions that improve local health and wellbeing, ensuring that integrated approach and having organisations coming together to work together towards that shared vision of building healthy communities. These are some useful references that you might like to refer to should you wish to be doing some additional work in this space. The purpose of this first video was to just set the scene of what chronic disease prevention is about and what it means across the North, and just to start to plant a seed for what that might mean for your organisation in contributing towards healthy communities across Northern Queensland. I hope you'll join us now in exploring the next two videos, which will take you then through some steps of planning and some examples of what can be done in local communities to collectively build healthy communities, potentially right across North Queensland.